But today I want to talk more about the foundations. Last week we were talking about the foundation of your life, of your philosophy, of all those sorts of things. And today I want to cover what's the philosophy and foundation of your dental practice as a business, as a clinician. How does that fit and what are you doing? You know, are you in the business of making money? Are you in the business of helping patients? Do you have a healthy balance of them all? How would you describe it if someone were to ask you about that? And what I want to do is I want to use some Sinek content here that I want to drop on the board to illustrate to you exactly what it is I'm talking about, because I think it's a powerful illustration. So I want to hop on the board here for a second, and I want to show you what I mean by this. One of the things that Sinek teaches in his book, Start With Why, which is an amazing, amazing book, he talks about the three circles, if you will. And what he talks about is you have a why you do what you do in the middle, and then on the outer circles you'll have how you do it, and then what you do. Now the challenge with most people and most businesses, and perhaps in your practice as well, is we all tend to start here with what. What do we do, how do we do it, and why do we do it? So in the case of a dental practice, it might be, what I do is get my patients out of pain by fixing their teeth, and I love what I do because I'm a dentist. I mean, can you hear some people trying to explain their philosophy about life, doing it in that order? And then similarly, or by contrast, if we go from the opposite extreme of, hey, you know, I love what I do in my practice. I change patients' lives. I get really excited about changing their lives. How I change their lives is by treating disease, solving their problems, improving the cosmetics, making their smile healthy, and I do that by fixing teeth. And it's amazing if you compare and contrast those two statements, how dramatically different they are. So I would suggest you put some thought into, and don't do it this direction. You got to start right here, and you got to work your way out. And I think if you work your way out regarding why you do what you do, how you do it, and then what you do, I think you'll see a transformational difference from an energy, from an enthusiasm perspective, and generally speaking from how your patients respond to you. So let's look at clinical philosophy and see how this relates, because I see some people, in my opinion, maybe doing it backwards. And when I look at what the most successful doctors I've run into across the country, I see them arrange and prioritize their practice around 5 areas. First is they treat periodontal disease. It does me no good to restore somebody's teeth if they're periodontally involved and they're going to fall out of the head. Secondly is I want to stop decay. It does me no good to do anything cosmetic if there's active decay in the patient's mouth. Thirdly is I'm going to look at alignment and bite issues, because those can cause periodontal disease and decay, as we all know. Fourthly, I'm going to look at joint issues and see how healthy the joint is and whether or not we have systemic issues there. And then lastly is I'm going to look at cosmetics, and I'm going to offer cosmetic solutions. The challenge I see is that most people, or too many people, are doing it backwards. How many offices are offering a whitening special for all new patients? Well, isn't that a little premature to offer a whitening special if we haven't even looked at decay, if we haven't even looked at periodontal disease? How many patients come in the door and they are periodontally involved, and instead of offering them the perio treatment they really need, in some cases, are there some offices that are just offering a prophy and sending them home with a tube of whitening? I think they are. And I know the majority of people who are watching this probably don't espouse those philosophies because you are the creme de la creme of the dentist. But let's face it, are there practices in your neighborhood, in your city that do just that? Absolutely there are. So I think in many cases those offices are doing it backwards. I believe if they have a philosophy of, here, I'm going to solve my patient's health issues, I'm going to transform their life through improving their oral health, where would you start? You'd have to start with periodontal disease and decay. You wouldn't start with cosmetics because it would be a waste of time, energy, and effort. So I believe if you go back to the start with why philosophy and you work outwards, this all solves itself. I've had conversations with doctors about this, and I realize I'm not a clinician. And by definition of not being a clinician, I'm really not qualified to have this conversation. But I had a doctor once, I was sitting there with Shar, it's one of her clients, we're having this conversation about this very thing, and this doctor just looks dumbfounded, staring at me like he didn't even know what to say. And Shar's looking at me like, oh, we're so going to get fired here because you just insulted how he runs his practice. And at the end of the conversation, he sat back and he's like, you know, I've been doing it wrong for like 10 or 12 years. He was one of those people. Good guy, not a bad guy by any means. I just don't think he ever slowed down to look at what it was he was doing, why he was doing it, and how he was doing it. And therefore, he was doing it like everybody else did. And that doesn't necessarily make it the right way. So I think it's important to step back, look at what it is that we're doing, how we're doing it, why we're doing it. And I think if we do those sorts of things, you will find an inspiration within you that will be far greater than you ever had.